Hello, and thanks for inviting us. I'm Nicola Brimblecombe, and this is my colleague Javiera Cartagena-Farias, and we work at the Care Policy and Evaluation Centre at the London School of Economics. We do quite a lot of work on unpaid care, and we're going to be presenting findings from a couple of those pieces of work today, funded by the NIHR School for Social Research and the Adult Social Care Policy Research Unit. Quick disclaimer. So a bit of background. There are, in England, unpaid carers provide the majority of care in England, sometimes called family carers, but more complex than that because it's often friends and neighbours and so on. There was over 5 million unpaid carers in England, according to the last census, and about 500,000 of those are under the age of 25, young or young adult carers. 2 in 3 of us will be unpaid carers at some point in our lives, and often at multiple points. Many of us will also be receivers of unpaid care. The provision of unpaid care is not particularly equal, with women, ethnic minorities, people in lower social classes, and people with fewer financial resources or living in more deprived areas more likely to provide care, especially at the higher levels, which we see have the more negative impacts. So there's 2 key things really from our presentation today. Unpaid care may be unpaid, but it certainly isn't free. It's not free to individuals and it's not free to government. And this looks a bit like a railway thing, but it actually is. It's also not equal. The impacts are not equal. The costs to individuals are not equal. So today we're going to talk about, as I say, some findings from 3 of our projects. So one is looking at the impacts of providing care on young adult carers aged 16 to 25 and the associated costs to government. And then another looking at all adult carers 16 and above, and another piece of work on carer poverty. And what is sometimes called deep poverty and other measures of financial distress. We use data from the the UK Household Longitudinal Study, huge nationally representative data set. And I won't say too much about the methods, but really we're looking at providing care at time 1, and then a year later, the impacts on individuals and the cost to government. I probably won't go into the matching, except to say there'll be 2 sets of findings, and one is all carers, but controlling for things like gender and ethnicity. And one is where we match them before caring and then during caring. The disadvantage of that is they haven't been caring for as long, and we know that the length of time you provide care is very linked to the impacts of providing care. So I'm going to start with young adult carers and talk you through this. So as I said, this is age 16 to 25. Young adult carers, young people, really, this is children and young people who provide care, are 2.4 times more likely to be unemployed. They're 2.6 times more likely to leave employment. They have worse mental health, but not statistically significant, worse physical health, and a loss of income. They earn £153 less from employment a month, which is quite a lot more with our match sample, but similar results. And as I said, this is controlling for many other things that we think might be associated with unemployment and poor mental health and low income. So who's most affected? As I say, this is not equally patterned at all. Male young adult carers are more likely to be unemployed, slightly different from the older carer population. Female young adult carers to have poorer mental health. Minoritized ethnic group young carers more likely to have impacts on their employment and physical health. Lower qualified was also another further disadvantage, and living in rented compared to owner-occupied housing was linked to more likely to be unemployed. So that's the costs, the impacts and the financial costs to individuals. This is what it looks like to the government. So each young adult carer is on average likely to pay £94 less tax a year, just under 47, to receive just under £47 in welfare benefits, and the cost to health service range between 273 a year to around 700 a year, depending on which group of carers we're looking at. In aggregate, thinking this is huge. So for the unmatched sample, this was in 2017 when we did this research. So this is a while ago now. This will be more expensive, and this is an annual cost every single year. It costs the government £624 million for the costs of young adult carers young people providing care, and £1 billion when we're looking at the match sample. So I'm not saying these are not necessarily bad costs. It's important that people get the welfare benefits they need. It's important they get the health costs they need. But I feel it could be much better spent by preventing some of these things in the first place, by having better support. Now going on to all adult carers, very similar methods. I'm going to look at the sort of individual impacts, and then Javiera will talk about the cost to government. So again, we look at 10 or more hours a week, carers caring for 10 or more hours a week here, because under 10 hours a week, caring often has quite positive effects, including on employment, mental health, and so on. But over 10 hours a week seems a threshold where you get these much more negative effects. And again, carers are more likely than non-carers to not being paid. Just turning this here so I don't keep turning on you. To not being paid employment, to have poorer mental health, the lower score is worse. To have poorer physical health, more likely to be lonely or isolated, and to have quite significantly lower mean earnings a year. And this is sort of, as I say, every year. Again, not experienced equally. Female carers here, more likely, greater earning penalty, worse mental health. Asian carers have a greater earnings penalty, and lower qualified carers, again, this kind of intersection of caring and other characteristics. And it says young, but this is younger carers tend to have worse mental health, older carers worse physical health, and younger carers were more lonely or isolated. So I'll now hand over to Javiera to look at what that looks like in cost to government.
Thank you. Can you hear me? Because that's told I'm quite short. So I'm going to show you now some findings on the cost of unpaid care to the public finances. So don't bother about the numbers too much. This is just to show that basically we did some work, and I'm not just pulling the figures out of my hat. But just to be clear with the methodology, in this first stage, we basically use all the sample of carers found in Understanding Society or the UK Household Longitudinal Survey. We use all of them, and we estimated that the total cost to the state was £21 billion per year. And we focus on three main costs to the state. So one is the annual welfare benefit. Then we went to annual foregone tax revenue, which mainly come from earnings, income tax, for example, and also the annual cost due to health care services. And so we arrived to that figure, the £21 billion. And we also look at difference between intensity of care, so how much will be the cost for those carers that provide 10 hours or less a week, and then those that provide more than 10 hours a week. And you can see, well, I told you not to look at the figures, but you can see how this one is much bigger. It's much bigger. So more intense care, it also implies a much higher cost to the state. And we also look at difference between younger carers and older carers, and the figures are not that comparable in the sense that one of the big costs, the foregone tax revenue, which come from earnings, and the majority of older people are already retired, so we cannot really compare the total cost, but we also estimate them separately. So the 21 billion sounds like a lot of money, and it is a lot of money, but we think it's an overestimated figure. The reason for that, I think Nick already mentioned it, is because in this figure, we are not taking account that some carers may have been in a worse situation before they became a carer. So they may have become a carer because they already have low employment perspectives, or because they were already in a bad health. So that's why we think that this figure overestimates, because include the fact that carers were already worse off before they became a carer. So what we did was a second estimation, which basically we use a matching procedure, and that means that we only include new carers. And we estimated that the total cost to the state every year is around £6.1 billion. Again, we have a problem with this figure, and the problem is that we only use new carers. And that means, we know that new carers in general, they provide low intensity of care, so less than 10 hours a week, because the intensity increase over time. So we have a sample of carers that in general will provide less care, and therefore they will have a less cost to the state. And therefore we think that that figure is underestimated. So we'll be between the 6.1 billion and the 21 billion a year. That's our estimation, which I know is a big difference, but aside and independent of how accurate that figure is, what we want to transmit is that, as Nick said at the beginning of the presentation, is that unpaid care is not free. It's not free to the individuals, but it's not also free to the state. And also, that they may reflect also the need, they are not necessarily bad things. I think also Nick mentioned it, that this goes to the state maybe to provide carers with health, with the support that they need, also with the welfare support that they need. So they are not necessarily costs. It's just to transmit that it's not free. It's not totally free. So we had another project, and we also look at poverty and financial distress among carers. And here we start very simple. We started looking at trends over time. We found quite surprising that this hasn't been done over time, just looking at poverty figures, comparing carers and non-carers. So you see on the top graph, you can see how clearly carers are worse off. The purple line, the poverty levels are around 25% over time, while non-carers are around 20% or even less. You can see how there is a small decline from 2017 until 2020. We don't really know why that happened, but around 2020 may have been because there were some welfare support associated to COVID, which then was withdrawn. And then the cost of living crisis started, and that's why you see in carers and non-carers an increase after 2020 on poverty levels. But the main message is basically carers are worse off. They have higher levels of poverty. Then we took carers and non-carers that were poor, they were below the poverty line, and we look at deep poverty. So those at the very end of the income distribution. And we found a surprising result, in a way, because we found that non-carers were actually worse off than carers. So you can see the lines were reversed in the bottom graph. The non-carers experienced deep poverty in a bigger level than carers. And we have a hypothesis for that, which we cannot prove, but the idea is that perhaps welfare support help the carers that are very extreme of the income distribution. It lifts them up out of deep poverty, but not necessarily out of poverty. So that's our hypothesis. Then we look at them, because before we were looking at poverty and income, and we also wanted to expand that and look at a more multidimensional measure of poverty and deprivation. So we look at material deprivation and financial distress. So we look at debt, how much they will be able to be out of debt. We look at savings, whether we're able to save every month. We look at their ability to do home repairs, and also to keep up with the utility bills, and to have money for basic things for themselves, and also to go on holiday. And in all of the cases, in all these indicators, carers are worse off than non-carers. And the gap over time, you can see how it keeps widening. So they are worse and worse over time. We also ran some regression analysis, some modeling, where we were able to control for other characteristics, so by gender, household size, the age of the carer, and also ethnicity, education, whether the household is located in a rural area or not, and also the employment. And when we did that, we found that there were some inequalities among carers, and we found that older carers are less likely to be in poverty, in deep poverty, and in financial distress. So it seems that younger carers are worse off compared to older carers. We also found that white British carers are less likely to be in poverty and in deep poverty than non-white British carers. And higher education and employment seems to be acting as a safety net. So they reduce the probability to be in poverty and in financial distress. And we also look at intensity of care. So higher intensity, we consider carers that are providing more than 20 or 35 hours of care a week. And they are more likely to be in poverty and in financial distress, but less likely to be in deep poverty. And this is consistent with what we found descriptively now when we run the analysis, controlling for other characteristics is also the case. And this, again, our hypothesis that perhaps support like the carer's allowance is only given to those carers that provide more than 35 hours a week of care, and therefore is supporting people at the very end, left side of the income distribution. And just to summarize and conclude our results from these several projects that we have been working on, we can say that providing unpaid care at higher hours has negative impact on young, but also on all carers, and it has substantial cost to the state. We also found that material deprivation is higher for carers than non-carers, and this, of course, reinforces the case for improving support for them. We also found that impacts of having caring responsibility are not equal, and therefore this suggests that some carers, some subgroups of carers may need other type of support or different combinations of support. The poverty, that was a bit an interesting finding, because we think that benefit could be lifting them out of deep poverty, but not out of poverty. And there is a consideration of the type of benefit that is given to carers, which in comparison with other OECD countries is still very low. So yeah, it may not be enough to lift them out of poverty. And in terms of policy and practice action, so we need to understand a bit better why there are this difference between across subgroups of carers. So we need more evidence that whether some subgroup, maybe the inequalities that we see in outcome, is it because they have lack of access to support? So we need more evidence on that. And obviously that has implications for reducing barriers to access support. And finally, we need also perhaps more evidence on how lower socioeconomic status workers, which in many cases are carers because they need flexible hours and sometimes they need to accept poorer conditions in order to have this flexibility, and what are the considerations in terms of employment rights and how to balance care responsibility with also having employment. And these are the papers that we have published that were referenced during the presentation. Thank you very much.